Hello, everybody. Welcome to Nurse Aid 1. My name is Marty, and I'm going to be working with you throughout this program. If you will, please get out your text. Okay, your text is Module A. Sorry, I wasn't on that screen. This is your book, basically, for this program. It was written by the North Carolina Department of Health and Human Services. This is the curriculum that they want everyone in North Carolina to teach. So that's what we'll do. Now, if you'll notice, it's going to be called modules. Modules are kind of like units or chapters. We aren't going to go A, B, C, D, E, F, G all the way through. We're going to kind of mix it up a little bit. We put them together the way we feel is logical. So that's how we're going to start. Okay, so probably when you get your things out, you're going to want to have a highlighter or a pen or a pencil or something so that you can make some notes along the side. Okay, so let's get started. The first thing that there will be just objectives. These are always going to be on the PowerPoint, and of course they're just going over the things that hopefully you're going to understand when you're finished with the unit. Okay, this is, I also want to show you, this is slide number 4, and if you look on your text, you'll see that the slides are in order. Slide 4, if you're ever looking down at your text and you want to go back and look at the PowerPoint again, which is online, you can do that, or you can come back here and do it. This is where you'll find it, and this should correspond with your text. Okay, it's not verbatim. It is not word for word. Your text, of course, is going to have more information. Also on your text, you're going to find a definition list at the beginning of every module. You're responsible for those definitions, and you're all adults, so I'm not going to read them to you, but I do insist that you go back over them when you finish the module and make sure that you could define each one of those words, okay? Because who knows where you may see them again. Hint, hint. All right, let's jump in. The very first thing they want to talk to you about is who you are as a nurse aide. And that is, and if you'll notice this word right here, a valued, unlicensed, those two words are huge. Valued and unlicensed member of the healthcare team. Those 3 words basically define you here. You are responsible for providing delegated nursing tasks, and we're going to talk about what delegated means in just a moment, within a defined range of function. Who determines that range of function of what you as a CNA can do versus an LPN versus a med aide versus an RN? You know, what is your range of function? And that's for residents or patients or clients. You know, we call them different things based on where they are. I've worked mainly in hospitals, and so most of my folks we referred to as patients. I worked in a doctor's office for a year, and they were more clients. Some people refer to them as patients, but a lot referred as clients. If you go to a nursing home, any kind of long-term care facility or assisted living, they're typically referred to as residents. And this program is more geared toward geriatrics and long-term care. The state felt like that was the place to start your education in health care. Doesn't mean that they expect every one of you to go into geriatrics. Most of you probably won't, but it's a good place to learn. Okay, all the skills you're going to learn here can be applied to anyone. It doesn't matter their age. This is going to also include being in a variety of settings. Oh my gracious, the places that a nurse aide can work. It's crazy. All the areas you can go into. Not even thinking about in a hospital, just about every floor in a hospital is going to use CNAs. Not all of them, but most of them are in some way, shape, or form. You can work in doctor's offices, you can work in clinics, you can work at the hospital, at urgent cares, and of course in long-term care. So you have lots of opportunities to find yourself and find your niche. Okay? All right, let's continue on. The Omnibus Budget Reconciliation Act. That is a mouthful, better known as OBRA. This is a federal law. It is a federal law that was enacted by Congress in 1987, and the whole purpose of it was for safety for residents. They found that people were getting jobs in nursing homes with criminal records. I mean, some coming right out of prison and, oh, let's just go work over here. People were being abused. Their money was being taken. It was just terrible. And so Congress finally decided to put their foot down. And what they did is they said, look, you people have to come up with some sort of a training program and a competency evaluation program. And people who are going in to work as a CNA, they have to have proof that they have had education and that it has been tested. So that's what this is. Okay, so looking at your book or at your module, the second bullet says designed to improve the quality of life of residents that are living in a nursing home environment. So that's your key, is why they did it, is to improve that quality of life. And there are a lot of things that go along with this, and as you move through this whole program, you will see where we refer back to OBRA quite frequently. Okay. Range of function for nurse aides. The Board of Nursing, the North Carolina Board of Nursing, decides exactly what it is, what tasks that a CNA1 can do. Let me just run up here and I'll show you. It's gonna show you the websites in a moment, or where to go to. This is the actual North Carolina Board of Nursing website. There are all kinds of things that you can do here. If you go on over under practice, you'll see there are nurse aides. There's not a whole lot else about nurse aide ones in this particular website, because they leave that up to the Department of Health and Human Services. But you can come right here and see that they have a place you can go to for tasks. And it'll show you exactly what your range of function is, what you can and cannot do. If you'll notice, there is nothing on here that says that you can pass medications or do sterile procedures, or several things that you can't do. It's not in your scope of practice. And if you do those things, you are way outside your scope of practice and could be prosecuted for that. And certainly the nurse who asked you to do it could be. So we just don't ever want to do that. Let's go back. So that's your range of function. Those are the things that you can do. All right. The regulatory body, this is screen number 7. The North Carolina Nurse Aide Registry. It's a registry of all people who meet state and federal training and testing requirements, which you will once you finish this program. The North Carolina Healthcare Personnel Education and Credentialing section of the state of North Carolina government that provides services for unlicensed healthcare workers. And remember, you are unlicensed. It also provides information to your employers and your instructors, like me. Maintains the North Carolina Nurse Aide Registry and approves the nurse aide training programs. Now, what are we talking about? We're talking about the North Carolina Healthcare Personnel Registry. And I believe I've got them right here. Yep. This is the North Carolina Department of Health and Human Services. Now, these websites, again, are in your text. Just a minute, you'll see them. But this is a really wonderful site. This is where your listing will show. This is the listing in the registry, and this is where your little name will eventually show up. If you go right here where it says Nurse Aide Registry, I'm over here on the left. You can look, and there's all kinds of information for you. Okay, all kinds of information. Can go to forms if there's something that you need to find. Can go in there under renewal. This is going to remind you if you forget anything about your renewal. You can go in here and remind yourself about what you have to do to get renewed. This website is where you'll go in. If you lose the form that they send you, you'll go in here and they'll send you another one. All right. So the North Carolina Healthcare Personnel Registry, that is your regulatory body. Registry requirements. Now, these are the things that you have to do to stay registered, and you must be registered to work. If you let it expire, you can't work. That's fraud. You cannot work if you let your registry expire. So what do you have to do to maintain it? Well, first of all, you have to, excuse me, First of all, you've got to pass the state test. And if you know anyone who is already a CNA, they've probably told you about the state test or Pearson VUE. Well, this is what it is. You have, after you finish the course, we send in a roster to Pearson VUE. These folks have finished the program successfully. They've gone through clinical. Everything is good. They are ready to take the state test. And you will come in. You have to register for it, and we will assist you with that. Costs $120, and you have to pay it the day you register. Okay, and there's no way around that. You can't register if you don't pay it. So you'll have to pay it on a credit card that day, and we'll give you that information. It will be at the very end of this course. It is a written exam. If you'll notice the word oral, if you have had an IEP in the past where you needed some provision for taking tests, you'll need to bring proof of that, not to me, but to the person at the school who is over that. And I'll talk to you about it. If you need that, you just need to see me, and I'll help you walk through that. But even in school and also on this state test, if you need an oral exam, then we can get that for you. Otherwise, everyone has to take the written exam. It's usually 70 questions, and everyone usually does just fine on it. Seriously, I wouldn't worry about that. And we have some practice tests that you can take too. You also have to demonstrate 5 skills, and you'll have to do that in 30 minutes. It's a choice of 22 skills. One, of course, will be hand washing. Then you're going to have to do 1 measurement, and then 3 other skills. You will not know what skills you have to demonstrate until you go in personally to test. Okay, so that just makes it fair and across the board fair. All right, if you notice in your text it say you're going to have 3 times. So if you don't pass it the first time, don't worry about it. Some people, their nerves just get the best of them, and they do need to take it again. If you do, you have 3 times that you can take it. All right, your listing renewals, what do you have to do to keep that registry? Well, it's not hard, really. We're talking about a 24-month period. A 24-month period. You have to work 8 hours. 8 hours. That's it. You just have to work 8 hours. However, that 8 hours cannot be for grandma doing her laundry, okay? You have to, number one, receive payment for it. You have to receive payment, and it has to be some sort of nursing or nursing-related activity. And here's your kicker. Here's what's going to get you. You have to be supervised by an RN. So you're going to have to work somewhere. If you're going to nursing school and you're just doing this to get into nursing school, you just need to keep in mind that if your nursing program is going to insist that you maintain the registry, you need to make sure that you can get on somewhere and just get that 1 8-hour period in, and you'll be fine. And they usually will work with you, but you have to pay attention. Now, look at in the blue. It says a nurse aide who does not perform at least 8 hours of qualified work during any 24-month period will be required to retake a state-approved nursing aide training program and retake and pass the state test. Just don't do that. Just don't let it expire. Okay, now here's what's going to happen. The renewal listing form is going to be mailed to the last known address of the nurse aide. So if you have an address change or a name change, it is very important that you go back to that website that I just showed you, the North Carolina Department of Health and Human Services, and get the form to change your name or address, whichever it is, and make sure they know, because you might get busy with life and forget that you're approaching that 24-month period, and maybe they sent you, maybe you moved and they sent it to your old address, and then you're just kind of in a mess. Okay, so make sure and change if anything changes your name or your address. Send in that renewal listing form on time. Now, who needs to sign it? Not just you. Remember that nurse I said that you have to work for? Well, she's got to sign. She or he has to sign it too. RN and nurse aide must sign the form, and the nurse aide should send in that listing form about 3 months prior to your expiration date. It also has, if you'll look on your module, the website that you can go to, that www.ncnar.org, that's the website that I showed you. And please remember, and it's got an important note, Nurse aides cannot work as a nurse aide once the listing expires. You can't. So here is a copy of what it's going to look like to you. It is scannable. This renewal form is, and you must mail it in 3 months prior to your listing date. Promptly report any changes or name or address. And here is another screen that shows you those two websites. Don't forget that they're in there. That's the Board of Nursing I showed you, and we went to this one also, and it's got all the forms and everything that you need. Okay. Let's move into what your job responsibilities are. Now they're going to be broken down in basically into 3 things. You've got your basic nursing skills, which is very similar with, like she's doing. She's taking a blood pressure, so vital signs are going to be part of a basic nursing skill. Personal care, that's the stuff that you do every morning. I mean, what did you do today? First thing you did when you got out of bed was, I went to the bathroom personally. So elimination, that's going to be part of personal care skills. Then I usually will wash my hands and brush my teeth. That's part of personal care skills. Might go up and get something to drink, get my coffee. All of these things are personal care skills. Interpersonal, gosh, I honestly couldn't tell you which one's more important. Interpersonal skills are the ones that we tend to forget about, and that's very sad, because you know what? This little person right here, if she doesn't have a relationship with you, if she hasn't learned to trust you, there's a lot of things about her and her condition you're not ever going to know, because she's not going to tell you. She's not going to want to bother you with it. So those interpersonal skills are huge. That's where you learn about this little lady right here. All right. Let's talk about delegation just a minute. Delegation is the nurse's responsibility. While you are with me, I am your nurse. I have been an RN for over 30 years, longer than most of you have been married. You will be working for me. Okay, so you are working on my license. So if you and I were going to a clinical site and we're on a hallway and we have 10 patients, and I have a couple of aides who have been there forever, know everything, know all the equipment, and I have a couple of aides who are very new and don't know the equipment. They know how to work lifts, but they've not been in serviced on our lifts. They've not been in serviced on our vital sign equipment. If I need someone to go get vital signs on everyone, who am I going to delegate that responsibility to? Well, I'm going to delegate it to the people who have done the in-service, right? So with that in mind, let's take a look at the definition. What exactly does it mean? Well, if I'm just going to look at this definition that's in your module, it's the process of assigning part of one's responsibility to another qualified person in a specific situation, and the other one, transferring responsibility for the performance of an activity or task. And here's the kicker for me, while retaining accountability for the outcome. Well, I have to retain accountability for what you do. So please bear that in mind. You and I have to develop a relationship too, don't we? I have some horror stories that I will share with you as we go along. Nurse uses delegation skills and legal regulations to assign duties and tasks to other health team members. It does improve efficiency. Gracious, if we've got 10 clients and I have to do every single thing for them, including going and doing all of these ADLs with them, taking everybody to the bathroom, getting everybody's vitals, plus pass my meds, plus do all of my charting, that's very inefficient, and our clients aren't going to be taken very good care of, are they? So it's efficient for me to use the aides in the way I see fit and what their strong points are. I would use my knowledge and do these 5 rights of delegation. If you'll look down at your book, you'll see nurse assesses the knowledge skills of the delegate and matches task to skills, meaning you. And here are the things I'm going to be paying attention to. The right task. Okay, the right task, like go back to the vital sign machine. If you've not had a chance to go through and get in serviced on the equipment, I can't delegate that to you. That would be the wrong task for you. the right circumstance, the right person, the right direction and communication, the right supervision and evaluation. All those things have to be in place before I delegate who's going to be doing what, before I make assignments, right? Your job, however, is just as important as mine, if not more so. Okay? What if I don't know that you haven't been through the in-service? What if I don't know that? What if I don't have a list of that and they just say, here are your aides to help you today? But you need to tell me, look at these next bullets, the things that you should ask yourselves. Do I have the information to do the task? Do I have any questions about it? Do I believe that I can do it and have the necessary skills? Do I have the equipment? Do I have the supplies? Do I know who my supervisor is and how I can get them? Have I told my supervisor if I need help to do the task? All these things, this is on you. Because let me tell you something, if I make assignments and you haven't been forthcoming with me about a problem, I'm going to have a really hard time working with you, aren't I? Trusting you, and you're going to have a hard time trusting me if I'm giving you things to do that you don't feel comfortable doing. It's a two-way street. So we have to work together, and delegation is huge. And going down to the next screen, points to remember about it: the nurse maintains the accountability. The nurse, me, I maintain the accountability and responsibility. The nurse delegates on a resident by resident basis. Never be afraid to ask for help. Oh, please never be afraid to ask for help, and always ask questions to understand the task. If you don't understand what I'm doing, don't feel like you're going to be stupid. As far as I'm concerned, there aren't any stupid questions. There really aren't. If you don't know, you should ask. And the task beyond the nurse aide skill level, talk with the supervisor. If you ever are working for a nurse and she says, would you please go pass these meds for me, and hands you a medicine cup with pills in it, says, could you go give these to Mr. Harrison? I'm so swamped. Don't do it. Just look at her, even though she's your friend, you've worked with her, and just remind her, say, I can't do this, but is there something else I can go do for you? Just remind her, because it's her license. Okay, just remind them, her or him. Lots of hims in nursing. All right. Basic nursing skills definition. Basic nursing skills would be monitoring, documenting, reporting vital signs, management of pain. Oh boy, we're going to have a whole little unit on pain. As directed by the nursing care plan, we're going to talk about that too. Application of warm cold, dressing changes, privacy. Oh boy, are we going to be driving this home for you? Privacy is the key. As soon as someone leaves their home and goes to a hospital or a nursing home, first thing they lose is their privacy. And in turn, right behind that, it goes their dignity and self-respect. Okay, so privacy is absolutely huge when you're performing any of these nursing skills. Important duties of the nurse aide: follow the resident's plan of care, follow directives from supervisors, report important findings. These are all critical for the well-being of residents. Absolutely huge. Now let's look at the personal care skills, working with the person. These are tasks dealing with the person's body, their appearance, and hygiene. Again, privacy is huge here. Absolutely huge. It's done on a daily basis, either in the morning, AM or PM, and in between. Each person has their own preferences, and that's where that relationship comes from, is knowing what their preferences are. When do they want to take a bath? What kind of soaps do they use? What kind of style do they use? You best be careful if you ever don't pay attention to when Ms. Johnson had her hair done at the beauty parlor and then turn around the next day and wash her hair in the shower. She is going to be tore completely out of her frame, as is her family who paid for it. So it's things like that. It's just knowing what you're doing and knowing your client. Hygiene, this keeps the body clean and healthy. Can be anywhere from a complete bed bath to just helping them brush their teeth, and grooming, of course, just makes them feel better about themselves, and dignity, and helping them with the nails. Oh my gosh, doing fingernail care is a wonderful time just for communication and just to hear them. Just listen. Just listen. What is AM care? Again, that's going to be all the things you do in the morning, toileting, mouth care before or after breakfast, sometimes both. I always encourage you to at least offer to help them do mouth care, brush their teeth before they go eat. Their food's going to taste a whole lot better. PM care is just making sure that they're comfortable, that if they've gotten sweaty, you've helped them to wash up, maybe a mouth care, possibly even a back rub. Just depends on the person and what they need. Personal care skills, again, those are your ADLs. You will hear this term a lot. ADLs, go ahead and just stick that in your brain. Activities of daily living. And again, it's all these things: hygiene, grooming, dressing, eating, transferring, toileting. It's all the things we do every single day. Okay? When you're providing personal care, please remember to let them be as independent as possible. Let's just look at this lady in your picture. I'm unsure what she's doing with that pitcher of water here, but let's go with this lovely lady with the toothbrush in her hand. If she's had a stroke, let's just say maybe she's had a stroke and she can't use this right arm that's tucked in, but she can use her left. She can't speak much anymore. She's not able to move much anymore. And let's just say maybe this lady was living relatively independently at home before this happened. How important is it? How important is it that you let her brush her own teeth? As simple a task as that is, it's something that she knows she can do for herself, because hopefully therapy is going to be working on her to be able to do as much for herself as she possibly can. And the aides, the nursing staff, we are terrible. We get in such a hurry because we have a big load, and we get in a hurry and we don't want to stop and let people do things for themselves because it takes them longer. That's just the truth of it. But this is so important. Her dignity and her self-respect is everything at this point, right? So we want to encourage them to be as independent and self-care motivated as is possible. Maintain a professional manner, provide privacy, there's that word again, and observe their skin, mobility, comfort, cognition. You are my eyes, you're my ears, you're my nose, everything. You are the ones that are going to be doing that bath or helping that person change. You're the one who's going to notice that red spot or that skin tear or that rash. You're the one who's going to see if they just don't seem to be as strong as they were yesterday. It's all on you. That's why you are so valued, because you're on the front line. You are truly on the front line. Personal skills, essential skills used when working with others, determined by many things. In a healthcare setting, it refers to the ability just to get along with people. Okay? Why are they so important? Because you interact with a whole big variety of people when you're on duty. A whole bunch of folks, not only the residents or your patients, but family members and co-workers. You interact with everyone, and what you're bringing, you make all the difference in the world in how you approach. Now, when you're caring for residents, you should try to empathize. Empathy versus sympathy. And we'll talk about this a little more in another unit, but just to kind of get you on that path, sympathy is feeling sorry for someone, and it's okay to feel sorry for people. It is. To have a heart for them. I have to assume that being in this class, you have a heart for people. Empathy is different, though. Empathy is different. Empathy is trying really hard to put yourself in their place, and it's hard to do a lot of times. A lot of you are young, very, very young, and to try to empathize with an 85-year-old woman who is sad one day because she's remembering, maybe it's the day that her husband passed away or her best friend, and that's hard for you. Now, how do you do that? How do you empathize with that? Well, you know what loss is. You know what loss feels like. And I'm not comparing the two, but you've probably lost an animal, a pet that you loved dearly. You could have lost a friend, you could have lost an aunt or an uncle, or even one of your parents or grandparents, but at some point you may have lost a job. Loss loss feels a lot the same. It's a missing. It's missing something. And so you have probably experienced on some level, maybe just not her level, maybe just not that loss of a spouse or a child or friends or all kinds of things, but you know what loss feels like. So you can go there. You can. So empathize with them. Try to understand how it feels. Anticipate their needs. You're going to hear me say a whole lot, run in front of it. That's what this means, to anticipate needs. If you are going into someone's room to help them get up for the first thing that morning, aren't you probably going to want to take some linen with you, a towel, maybe a couple of washcloths? If they ring out and say, I've had an accident, could you come and help me? You're definitely going to want to take those things, and you need to plan to help them get cleaned up and their clothes changed and maybe a bed change, whatever. That's anticipating needs. Treat each person as an individual and honor requests when at all possible. You can't honor all requests, but do the very best that you can to honor their requests. Okay, display patience and tolerance and be sensitive to their moods and mindful of yours. Don't bring your problems from home into your workplace. It's hard to do, but try really hard to leave your prejudices, and everyone has them. Everyone has them, has their judgments and their prejudices. Try to leave them at the door. That's not what you're signing up for, folks. It's not. Okay, it's just not. We're signing up to take care of people, period. Be respectful to their family, maintain professional relationships with the team of folks that you're working with, and try to maintain open, effective communication. Now, as an employee, it's very important that you act and behave professionally and have a good work ethic. Appearance. Gracious, this has changed as generations change. That's why a lot of times you're going to work in places that say um, no tattoos, no extra earrings, all that stuff. And part of that is simply because of the clients you're working with. They're from a generation a lot of times that those things were taboo. You didn't do that. And so a lot of times, especially the long-term care facilities, will want you to cover those things up just because it may offend the clientele. Also, please remember that the people who are hiring you at hospitals and doctors' offices, those coveted jobs that you want, they're oftentimes people of a different generation to you too. And so their point of view, whereas they should not discriminate, they are human beings. And if it's between you and 5 other people and you go in, with go into an interview with jeans on and 12 earrings in your ears and one in your nose and one in your eyebrow and in your lip and your tongue and everywhere else, and you got tattoo sleeves on your arms, the person who is interviewing you might think, maybe this wouldn't work out. And that's a shame, because you may be a perfectly wonderful aide, but people's prejudices are going to be in their heads no matter what. So when you go to work, you need to follow whatever dress code is going on with your facility, and that's going to back you up. If somebody says to you, you shouldn't have that, those 4 earrings in your ear, you can say to them, and it backs you up, well, our facility allows for that. Also, make sure you know about what their nail policy are. A lot of places, and I know the hospitals, you cannot wear any kind of fake nails in there because they harbor germs. So follow the dress code for uniform and jewelry. Dresses should be modest, clean uniform, no tears, wrinkles. Your badge with your name on it should be visible at all time. Wear clean, non-skid, closed-toed, comfortable shoes, and wear clean undergarments, please. I really hate that that's even in there and has to be said, but it does. That body art, the neat nails, simple hairstyle, all of those things. Again, start with what your facility insists upon. Your nails, when you turn palm up and just look at your fingers, your nails should just barely be able to be seen over the top of your fingers. And again, you're not going to want to wear artificial nails. Okay. Wear clean stockings or socks. And again, we talked about the jewelry already. Just flash that big smile and no big heavy makeup, okay? It does, honestly, I promise, about 15 seconds to make a first impression. And so you want to make a good one. That first impression is important, especially if you go for a job interview. Your attitude, patient and understanding, honest and trustworthy, conscientious, always trying to do your best, enthusiastic about the job, courteous, considerate, respectful, and cheerful. Now, you know, isn't that what you want if you're in the hospital or if you're there with a family member? Isn't that what you would want from the nurse aide who comes in to assist you? You would want all those things. So you need to try to be that. Dependable and responsible, accountable, tolerant, self-aware, and cares. Really, really cares. The facility you work for is going to want this in you. And when they call me, if you put me down as a reference at the end of all this, these are some of the things they ask me. Are they dependable? Are they accountable? Are they self-aware? Do they, would they make a good aide? Do they care about their people? Strive to be the very nurse aide that you can be, because whoever you're working for, they're going to be counting on you. All right. As a nurse aide, you need to understand the requirements. Remember what you have to do to stay on the registry, and about your grooming and your hygiene. Show up for work on time. Use sick time for sick time. Give an honest day's work, honest day's pay. Be respectful, kind and gentle. Empathetic, putting yourself in the other person's shoes. That's having empathy. Be pleasant and respectful. Always do your best. And oh, please, as a nurse, as your nurse, please, please don't be afraid to ask for help. Please don't. And that includes in the lab when I'm teaching you skills. Just say, I don't understand, show me again. All right, the role of the nurse aide: treat others with dignity, be a team player, careful and alert, eager, excited to go to work. Do not gossip. Don't lie, cheat, or steal. Always seek the good in others, because you know what? There is good in the world. There is. There is good in the world. And I will be encouraging you through this entire thing to be the good. Be the good that people look for. Praise others. Praise your clients when they do a good job. Praise them. Everybody needs to hear that. And keep your language clean. No cursing and no telling of off-color jokes. That's just not cool in any setting. If you're not sure about what you're getting ready to do, don't do it. Don't do it. It's your conscience talking. Now, I'm going to talk just a minute about what a team is and being a team player. It's a group of people with a common purpose. They have assigned tasks. They coordinate effort to get the job done. That's what a team is. Now, team members work together, function, all their little different parts to make a whole. They communicate with each other. They coordinate work activities, share responsibility. They receive assignments to ensure them that each team member knows what to do. You are a member of the team. As a nurse aide 1, you are a member of the team. Now, there's 2 different types of teams. You have an effective team, one that works together. Isn't that beautiful? One that works together. And when you have an effective team, when everything is flowing and everybody's working together, this is what you'll find. The climate, we're not talking about the temperature in the room. We're talking about just the general feel. It's informal. Okay, in a climate of an effective team, it's comfortable. Okay, it's informal, it's relaxed, members are interested, they're talking. Communication is open, it's two-way, ideas and feelings are encouraged. The interactions between the team members are inclusive, they're trusting. People like each other and like working together. Goals and tasks are appropriate, they're understood and modified so that work gets done. The leaders lead, The members participate in a respectful and cooperative manner. Everyone pulls together. There's high levels of inclusion, trust, liking, and support. And problem solving is high. When a problem arises, people consult with appropriate resources and work to solve the problem. They work together to solve the problem. Therefore, problem solving is high. Now, if you have a group that's ineffective, and I have been in some of these teams, and I am here to tell you it's tense. It's always tense. People hate going to these meetings because it's closed. There's no communication at all. It is one way. People are basically just speaking at each other, not to each other. Ideas and feelings are discouraged. People don't speak up. They're hesitant because they'll get their head bit off. It's based on authority only. People with power dominate over everyone else and make them feel like they don't deserve their time. The goals are unclear and misunderstood and forced. Decision making is done by just the person in charge. There's distrust among the members because they're being forced to do something. Getting along, they don't. There's disagreements all over the place, and problem solving is very low. Criticism is destructive. Members are attacked. The job doesn't get done. Now, if you have that team that works together, feel a strong sense of belonging. They enjoy being with each other. They ask each other for advice, and they seek and provide support in times of difficulty. With a strong group, everybody values each other. They're motivated to do a good job. They share group feelings openly, and they believe the goal of the group is important and achievable. Now, there is a worksheet in the back of your module. It's called a Go Team worksheet. And what I would like for you to do, I was going to put this online, but I think what I'm going to have you do is just go through and answer it yourselves at home. And if you will, just pull it out and stick it in with your skills to bring with you when you come and see me in lab. All right, so if you will just pull that out, do it, pull it out, and then stick it in there. Okay, bring it with you. So that concludes our Module A, and I will be talking to you again very soon. Thank you. Bye.